everyone. I'm Rebecca Vickers with the Florida Alcohol and Drug Abuse Association. We will be getting started right at 10 a.m. Thank you for joining us. Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Natural Supports and Recovery Management for Children and Families with Ashley Gonzler. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse, Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is located on the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone option to call into the presentation. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADAA website within 30 business days. To access the recording and the PowerPoint, go to our website, then to our Resource Center, and then to our training library. FADAA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADAA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADAA as a part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight, Friday, February 4th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certificate number when registering with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Ashley Gonzler leads a specialty coordinated care team comprised of clinicians, prescribers, peer mentors, education, and employment specialists who collaborate to support transition-age youth at Threshold's Emerging Adults Division in Chicago, Illinois. In this role, she engages in preventative work, crisis intervention, and uses a strength-based approach to help youth, young adults, and their families with identifying tangible ways to break generational cycles and begin to create sustainable, healthy, adaptive patterns. A graduate of Michigan State University, Ashley holds an advanced training in cognitive behavioral therapy for psychosis, the best practice for treating individuals experiencing their first episode of psychosis, and is trained in the structured intervention of psychosis risk syndromes to detect individuals at clinically high risk of developing psychosis. At CHR Team Lead, she is committed to identifying and providing preventative treatment to individuals most at risk for developing serious mental illness. And now I'd like to welcome our presenter, Ashley. I will turn the presentation over to you.
Good morning, everyone. Thank you so much for the introduction, Rebecca, for FADAA, for having me today, and for the Florida Department of Children and Families, and for you all attending today. As we get started, and as I start to introduce myself, I would love for each of you to go ahead and write in the chat something about what you do, whether it's in your role as a professional or a supporter, and which populations you tend to work with. So whether it's families, whether it's children, it's adults, it's a mixture, just go ahead and give me some information, send it to the chat so then I get a sense of what it is that you all do as I talk about my work. So, as Rebecca said, I'm located in Chicago, Illinois, and I work with the Mind Strong program at a community mental health agency called Thresholds. So, Mind Strong is a multi step care program that uses a multidisciplinary, evidence informed approach to identify and treat young people who are at risk for serious mental health challenges or emerging psychosis symptoms. Early assessment and services are key in the return of young people to a healthy and fulfilling life. So, part of my background includes a passion of working with youth and young adults. And in this role with Thresholds and being the point person to help support individuals who are newly experiencing psychosis or at risk of experiencing psychosis, one thing I've come to realize is how important that individual's support system or family system is to recovery. So we describe someone's family as whoever they consider a support to them. And in incorporating the family, which can be partners, friends, cousins, family members, whomever they identify, I've come to realize how helpful that is in not just better understanding this young person and what it is they're experiencing, but also to empower those support people to feel what they're doing is so helpful and to really just um, help support this young person on their journey of recovery in a very intentional way. So I see that some people are go ahead and have mentioned in the chat, and so I'm reading it. I don't know if you all can see it, but we've got some other people that are working with young adults too, adult behavioral case management, wraparound services. These are all great. Please keep sending those in as we move forward. So the learning objectives today include identifying rationales for involving natural supports and family members in treatment and post-recovery and post-treatment through recovery management practices. So I'll be able to fold in some examples of specific ways in which I found incorporating the families have helped with my own work. We'll also learn about strategies for involving natural supports in treatment and recovery management, because sometimes that can be a barrier, sometimes how people view different support services or systems, or maybe there's lack of time. We all know that, things have been tough for all of us in these past few years. And so it could be, how do we engage someone who's not physically close? And then lastly, it's learning about what's called stress vulnerability and how it applies to families and natural support. So as we begin today, I'm thinking already ahead, just, why do people sign up for this training? Is it maybe because you want to break up your work day? It's a nicer way to ease into the work week on a Monday. Maybe you're in need of some CEUs, but my theory at the end of the day is that there's something about the work you do and your passions that align with the description of the training. So while I read over the learning objectives, I also want to review and read over the learning description, because I think that's what really draws us into what we're dedicating our time, effort, and energy to. So families and natural supports are in a unique position to disrupt the course of substance use disorders and mental health conditions by providing intentional support and contributing to a healthy environment for the person in recovery. Empowering families and natural supports with psychoeducation, normalization, and guided support can not only improve outcomes for the individual, but also it can give permission for supports to prioritize their own wellness. When individuals in recovery feel validated, understood, and their environmental stress is lowered, they can move forward in recovery. So as we move forward in this presentation today, it is 2 hours long, and I want you all to be intentional about how you're using your time. If you find yourself getting distracted, get up, walk away, come back, get a glass of water, do what you need to do, just to stay focused and allow yourself to absorb this information and think about ways in which you might incorporate it into your day-to-day life when it comes to working with people, or maybe you're in the position of supporting someone in recovery. So let's go ahead and get started in talking through what is a recovery-oriented system of care. So this really represents a shift from only therapeutic and clinical interventions to adding non-clinical community-based resources that support recovery, early identification, engagement, and suspension of recovery progress for individuals and families. So through these services, individuals, families, and communities can gain access to recovery-focused services and support that will increase successful treatment completion rates, promote early re-engagement for those who have relapsed, and provide pathways to recovery for individuals not in need of clinical treatment services. Such a system would provide ongoing recovery-based services throughout the lifespan. So it's not just acute distress moments, it's thinking about support throughout the course of the ups and downs, the termination and re-engagement as needed. And I think that's incredibly helpful, not just for the person in recovery, but also for the natural supports, the people within their community, to also have access to support services and not view that as only when things are really going wrong or things are really in distress. So here are some of the guiding principles of recovery. So first of all, as you all know, there are many pathways to recovery. It's a lifelong process of change that permits an individual to make healthy choices and improve the quality of their life. Recovery is also self-directed and empowering. And another really important piece that stands out to me with creating this training is that the person in recovery has the authority to exercise choices. So especially in my work, where I work with people who typically are like late teens, early 20s, and they're emerging into adulthood, they're in this transition period where they're learning how to function and operate without maybe like intensive supports from family or loved ones, but also they're kind of getting their footing down with what it means to be an adult and how to make that happen and what that looks like and all the fun and not fun stuff that comes with it. And so it's a lot of wanting to, as like a support person, like guide someone to help them through it, but also recognizing like this person has autonomy and they have the right to make decisions, even if that's something that's not necessarily what we would pick. So autonomy and self-empowerment can lead individuals to become optimistic about life goals. So individuals are unique and with specific needs, strengths, goals, attitudes, behaviors, and expectations for recovery. Pathways to recovery are highly personal and generally involve a redefinition of identity in the face of crisis or a process of progressive change. Furthermore, pathways are often social, grounded in cultural beliefs or traditions, and involve informal community resources, which provide support for recovery. The pathway to recovery may include one or more episodes of psychosocial and/or pharmacological treatment. For some, recovery involves neither treatment nor involvement with mutual aid groups. So it's really important to always be curious, ask questions, and to better understand what it is that the person defines as their recovery process and what's important and what's not important. So again, recovery involves a personal recognition of the need for change and transformation. So what we're talking about here is that individuals must accept that a problem exists and be willing to take steps to address it. These steps usually involve seeking help for alcohol and other drug dependence. And the process of change can involve physical, emotional, intellectual, and spiritual aspects of the person's life. Recovery is holistic. So recovery is a process through which one gradually achieves greater balance of mind, body, and spirit in relation to other aspects of one's life, including family, work, and community. Another thing I want you all to think about is like within your current role and position, how much emphasis is focused on or supported by helping people who are in different stages of recovery start to think about or get tangible support for things such as education or employment or something like volunteering. In my work with youth and young adults, we have individuals within our teams specifically identified to help either, well, really to help the process wherever the young person is at. So it could be in the discovery stage of, I'm trying to figure out if I want to go to school, if school's important to me, or it could be, I need to work, I've got bills to pay, and I'm willing to work anywhere. Or it could be, I want to work, but I want it to be in alignment with a degree I have or a passion I'm excited about. So really think about like how much focus and attention is given not just to treating what it is that might be the presenting symptoms, but also in order to help create this balance in the sense of an individual in recovery's life is more than just treating the substance use disorder, but also like we want to help people have lives that feel fulfilling and sustainable. And I think that's really, really important. And I love that there are so many places that have those sort of support services already in place. The last one for the slide is recovery has cultural dimensions. So each person's recovery process is unique and impacted by cultural beliefs and traditions. A person's cultural experience often shapes the recovery path that is right for them. And it's also on us to, again, maintain our curiosity, ask questions, and try to better understand individuals' backgrounds so that we can provide more of an informed, thoughtful approach when we're working with people. So recovery exists on a continuum of improved health and wellness. So recovery is certainly not a linear process. It is based on continual growth and improved functioning. It may involve relapse and other setbacks, which are a natural part of the continuum, but not inevitable outcomes. Wellness is the result of improved care and balance of mind, body, and spirit. It is a product of the recovery process. So I like to think about this as it's not linear, but also in my work with individuals who have experienced their first episode of psychosis, we tend to see that like a lot of our individuals come into our services after being in the hospital for the first time. And so when we first start working with that young person and or their family or support people, they tend to be very focused on not wanting to have that experience of going to the hospital again. So it's like they'll ask questions about how do we stop this from happening? We really need to make sure that we don't end up in the hospital because it was very scary. There was a lot of things happening, felt really out of control. And while it is possible for individuals to have one hospitalization throughout their lifetime, we tend to see that people tend to have those sort of experiences where they are in crisis and might end up at the hospital, might not, but that can be part of this process, this larger process of trying to figure out for each individual what are the things that combined together help create a sustainable recovery plan where they are able to do the things that they want to do and manage the things that are important for them to manage in a way that feels conducive to who they are and their belief systems and what's important to them. So something to think about as we're talking to people that, you know, when we're in a situation where we're seeking out services and we want support, we might have a lot of fear coming in with us. And so if we're the other person in the room with them or their family members, it's really being cognizant of that fear and not just saying things to help them feel better, but rather like opening the door to a different image about what recovery can look like. And that if there are setbacks or relapses, that doesn't mean the individual failed or they have to start over. Rather, it's a way to gather more information of things that are helpful or maybe aren't so helpful that could be tweaked or changed. So next, recovery emerges from hope and gratitude. So individuals in or seeking recovery often gain hope from those who share their search for or experience of recovery. They see that people can and do overcome the obstacles that confront them, and they cultivate gratitude for the opportunities that each day of recovery offers. Recovery involves a process of healing and redefinition for self and family. So recovery being holistic healing process, and it also is one that develops a positive and meaningful sense of identity. So think about it this way. If we're in the crux of a crisis and trying to sort out what we want our trajectory to look like, it also feels very daunting to have this idea of, wait, I have to create my own identity if I'm going to move forward in recovery. But I think of it as, instead of a daunting task, it puts us on a map of discovery where we get to start to make informed decisions to move forward and pick up things that help us and drop the things that no longer service us. So recovery involves addressing discrimination and transcending shame and stigma. So it's a process by which individuals, families, and communities confront and strive to overcome discrimination, shame, and stigma by advocating for self and others. So I'll talk about this later on, and there are specific resources that are on the resource page of this PowerPoint, but I also want to just name too that it is so important for individuals in recovery and their support people to have others that they can connect to in order to decrease this shame and stigma that tends to keep people away from support systems. So on our team, we have an individual whose title is peer mentor, and they're someone who is able to utilize their own experiences to help normalize the process of recovery. And I think that the having that up here on the team and having our young people have access to someone who is comfortable and open to talking about their own process within recovery has been a game changer for a lot of young people. Sometimes that's our starting point of building up a connection with the peer mentor to help that person feel more comfortable with exploring what services could look like. And so I think it's a really important thing for us to remember is that there's a lot of deep feelings of shame and stigma. And when it comes to individuals and their families, like we want to better create more of this normalization of how difficult recovery can be in that process of getting to the point of wanting help as well. So peers and family members and other allies are vital support networks for people in recovery. Providing service to others and experiencing mutual healing can help create a community of support among those in recovery. Recovery involves rejoining and rebuilding a life in the community, and recovery is a reality. At the end of the day, recovery is a reality, and that's something we want to continue to reinforce to the person or support people who might be in that process of recovery. Okay, next we're going to dive deeper into the elements of a recovery-oriented system of care. So first off, it's very important that it's person-centered. So an individual will be able to have a menu of choices that fits their needs throughout the recovery process. It's not you go through a lunch line, everyone gets the same thing. You want to be able to offer people different strategies and approaches that might best service them. We also want to be inclusive of individuals and families in recovery, hence the need for this training. We also want to be mindful of potential barriers, such as financial supports and sometimes transportation and technology, those sorts of things. And also, again, going back to having a person have the autonomy and authority for choices, we really want to make sure that the individual gives their permission to have family members or allies incorporated in the recovery planning and support process. So if a person might have some supports, but they're not willing to have them, let's say, involved in the process, or at least not at this time, while that doesn't give us the open door to then engage the family or support people, what I think of it as, it gives us the opportunity to further explore that. What is it about that relationship or the dynamics where a person might be really hesitant to have that support person involved? Is it tied back to some of those feelings of shame or stigma? Is it that they feel like their support person might not understand, or that they'll have to, sometimes it's this idea of like all or nothing. So it might be that they think like their support person will be in every therapy session and hearing all their business and all the details about their mental health condition or substance use patterns. And so that could be really off-putting to think about, like how, like, I don't want anyone in my business, and especially the person like I'm living with or have to kind of talk to about these things. So I think it's also important to name that your curiosity in that scenario can help to better understand what might be a barrier to having a support person involved. And even if you don't end up directly involving them, there are other ways and avenues to incorporate those people into an individual's recovery in a way that's more conducive to support, in which the person might see that as. So as we continue on, I missed a note just wanting to say that, so these elements of the recovery-oriented system of care are kind of like guiding principles. So they're rooted in the very core of the system's values. And they're the individual components that make up the whole. So these elements of the system are those smaller parts that are similar to the larger system in that they can be described as common in value, behaviors, and identity. So therefore, these elements are broken down into their individual parts and have recovery as their fundamental ingredient. Okay. So next, we're going to talk about inclusion of voices and experiences of recovering individuals and their families. So inclusion in the decision-making process, implementation, and monitoring of systems which provide services. So this would include advisory councils, boards, task force, and communities at federal, state, and local levels. In the time that I've been working within Thresholds, I've seen the development and implementation of a youth and young adult advisory board, and I've had several of my clients actually be elected into those positions, and I've watched how it's transformed how they view their own recovery and their approach to supporting their peers in their own recovery as well through this avenue. And I think sometimes thinking about how we give people a voice, and not just that, not just hearing their voice, but being part of that process when we're making decisions or we're trying to determine if a certain program or support service is really meeting the needs that it is we're intending it to meet. Like, we need to get back to the source of the individuals who are in that process of utilizing that service and can give that direct feedback, as opposed to just guessing or kind of hoping that it lands. So promoting access and engagement. So this means each person who seeks services should be afforded every opportunity to access appropriate addiction treatment and recovery support. A recovery-oriented system of care promotes access to care by facilitating swift and uncomplicated entry and by removing barriers to receive services. Engagement involves making contact with a person as opposed to their condition or disease, building trust over time, attending to the person's stated goals and needs, and directly or indirectly providing a range of services in addition to clinical care. This involves linkages. So when I think about access and engagement and the process that it takes to build trust with someone over time, and to not just hear someone's goals and their, like, what it is that's important to them, but really intentionally incorporate that into what it is that, like, we're working on together. I can think about sometimes I feel like I did that very well. And I can also think about some times in which I had my own misstep and had to come back from that. So if anyone, feel free, if anyone is comfortable, to put in the chat any moments where they remember a misstep of maybe wanting to approach supporting someone or in their services, and you had to come back and almost like humble yourself and say, wait a second, I might think that this is best for this individual, but that's not what they want. And by me trying to push the agenda I think would be most helpful for them, it's really actually creating a bigger barrier to getting those support services right now. So I can think about this specifically with one individual who had family supports. Mostly it was his parents, and his parents really, really wanted to be helpful and supportive of him, but they also became very alarmed and afraid when he was experiencing emerging symptoms, so mental health symptoms. And so the mom in particular very much wanted to be involved in any and everything related to services, support, our family support, and education process. Um, and I was like, oh, this is great. We can work with mom. This will be wonderful. I talked to the client and he was like, nope, I don't want to. I was like, but hold on, wait, like you have parents here and the mom is super willing to engage in support services. Okay, even if we don't do this all together as a family, could we all just meet once and just kind of talk about the program we have, the supports we have to offer, and kind of see from there? I thought it was going to be my subtle way of kind of getting my foot in the door and bringing in this young person's family. I'm like, this is going to be great. Come on in. And it was not even a full hour long, and I was able to see the dynamics in which the mother who was trying to advocate really tended to overstep and not allow her son to have that voice that it was he was looking to have reinforced. So long story short, looking back at that scenario, I had to step back and take things at his pace. Eventually, we got to the point where he was okay with the parents receiving their own support, and they would get information, like mostly psychoeducation around relapse prevention, crisis management, that sort of thing. And that I was able to continue to work with him. But that was one of those moments where I realized, because I wanted to do something sooner than he was ready for and not in the same way he was comfortable with, I had to backtrack. I had to backtrack and really be able to rebuild that trust, because I moved quicker than I should have in that scenario. So just something to think about is, like, we all have those well-intentioned moments and where we think, oh, this is going to be great. This is the best case scenario. And then we have to like pause and come back to, okay, what is it that really, what is it that what we're really trying to get at here, and how do I make sure that it's not based in my own lens, but within the context of what this individual wants this to look like. We have a few responses in the chat. I just want to read them. So we have Colleen, who said that they work with RAP principles, and it was different to get used to, but that they would not do it any other way. I wonder if anyone else within the training also works with RAP. Go ahead and send it in. We also have Idra saying, when youth have turned age 18, parents often do not give them the autonomy needed to establish services around their independent goals as adults. They hinder their acceptance of services needed to encourage recovery. Yeah, so that's something I've certainly seen in my own work. Once someone turns 18, they are adults and can make their own choices, but it gets complicated when they might have parents who are very much involved in their life, maybe even like still live at home with them, and maybe they have their own experiences within services or recovery and want to kind of still keep the reins on how it is that it should look. And so it takes some detangling in order to help both the young person who is an adult but is getting their footing down, and the parent or parents to help kind of take a step back and allow this process to unfold, even if it is a slower process where it takes longer for the young person to feel more comfortable making those decisions. It is something that, faster isn't always better, and allowing them that process can help build their confidence in themselves and their decision making, which is then in turn going to help their whole recovery process. Oh, great. Linda is also a RAP facilitator and absolutely finds great value in it. Wonderful. All right. Okay, so linkages. Collaboration is key to providing a wide range of services and resources, so individuals will have access to a wider array of resources critical to the recovery process. So this might include housing, employment, medical care. What are some other ones people think about when they think about, like, in the work that you do, what's an important way in which you collaborate or link for a person you might work with? So earlier I was talking about we have an education and employment specialist that works with young people in order to help, even if they're not sure what they want to do, to help within the discovery process. And then for both education and employment, the staff person will find ways within the context of how comfortable the young person is of like helping to bridge that gap. So I'll give you an example for education. So let's say if a young person is excited to go to college but feeling really anxious about the process of filling out the FAFSA form and signing up for classes, our education specialist would actually work alongside them and have them do it, but do it together so that it can be a learning experience to do alongside, as opposed to kind of doing for someone else, but can help lessen the gap. And so like another example of educational support could be like linkages. So I know in my work, I've also connected, with the permission of the individual, I've connected with like school counselors or staff to help work through that process if there's any like glitches with signing up for classes or accommodations for mental health conditions, that sort of thing. So again, it's not just being able to say, here's a resource, go and take it, figure it out. It's like ways to kind of, you're really looking at it as ways to decrease barriers for these things to not just be implemented, but to be effective and to be cohesive. So the individual is not just worried about, okay, well, here's another thing I have to do. It's helping to eliminate an extra step so that we can move forward with the individual. Okay, we've got some good responses here. So financial supports in the community. Oh, thank you, Jerry, for your comments. Actually happened to me. The services of training were pushed to me to go into a different branch of medical field. My ability to retain knowledge of medicines and terminology is limited, but I was forced into that training. Savannah works with teachers, JPOs, family, and medical team. Okay. Oh, Amanda, very cool. A foster parent, bridging gap with parents so they can focus on helping themselves and not stress about care of their children or child. Yeah, I think that's really important. So again, these linkages, if I'm someone who's providing support to a person in recovery or a person with a mental health condition, I want to be very intentional and notice the system and notice areas where someone in a caregiving role really could benefit from supports, and not just saying, oh, maybe you should look into that on your own, but rather be able to offer, like NAMI has the family to family free groups where they do training over the course of several weeks, and you get to be around other families who are going through similar experiences or setting up a referral for, let's say, a parent who wants specific support around parenting a young person with a serious mental health condition. So those sorts of things, like linkages really is like, how can we do the next step instead of just providing the information? How do we make sure we can connect things together so that it decreases another barrier that might prevent someone from getting those supports or services, or like those critical, like basic needs met of having like a safe and secure place to go. Okay, so individualized and comprehensive services across the lifespan. So a recovery-oriented system of care offers a menu of comprehensive services which are individualized, stage appropriate, and flexible across the lifespan. So systems will adapt to the needs of individuals rather than requiring individuals to adapt to them. So just like I talked about earlier, walking through a lunch line in school, it's not just put everything on the tray. Everyone should have the same thing. It's being able to adapt and be flexible to individuals and their needs. So they are designed to support recovery across the lifespan. The approach to alcohol and other drug-related issues will change from an acute-based model to one that manages chronic diseases over a lifetime. So just like I said, when people come in for care, a lot of times it's after having an acute crisis where they might have ended up in the hospital or something so big that it then made them kind of think about what kind of supports or services they might be interested in. But really the idea is like providing care throughout the ups and downs based on stage and stages of change that they're in. So it's not just a one size fits all. It's a way to ensure that throughout the span, people are having the sort of supports and options that they need and deserve. Okay, so I'm seeing a question in the chat about, is there a way to view all the chat, or can we just see the panelist chat? It's my understanding that I think you can just see the panelist chat. If I'm not correct in that, either Rebecca or maybe Eric can mention that or put that in the chat. I'm not really sure, but I'll do my best to read people's responses so you all can kind of hear what other people are saying, because you're unable to see it. Okay, so systems anchored in the community. So these enhance availability and support capacities of families, intimate social networks, and community-based recovery supports. And it's also ensuring continuity of care. So individuals should have a full range of stage-appropriate services from which to choose at any point in the recovery process. So we're talking about this continuum of care, meaning pre-treatment, treatment, continuing care, and recovery support. And I think too, working with individuals who it might be their first time seeking support or services, just to name that as well. It's not just this one-time thing. It's an overarching view of how things can look depending on where you're at in your recovery. So a good place to share some psychoeducation about how that'll look. Okay. So next is partnership consultant relationships. Focus on collaboration versus hierarchy. So individuals feel empowered to direct their own recovery with safety. So I think about this as like when I'm working with a young person, Sometimes I might ask a question, even if it's as simple as like, okay, when do you want to schedule next? When should we come back together? They might respond, I don't know, what do you think? Or, oh, it's up to you. And in those moments, I try to be very intentional about, well, I appreciate you saying that. And this is support intended to be helpful for you. And I'd really like to hear if you think meeting weekly or even twice a week would be useful here. So it's not just creating the space and saying, you get to make the choice if you want it. It's really being able to say, like, walk them through that process of making those decisions. So whether we're talking about someone who's a young adult who's experiencing their first symptoms of a mental health condition or someone within their recovery process, it's really wanting to help step through that process with them to help guide them through, again, their new sense of identity, their new sense of self. Obviously, we want to be strength-based. So we want to amplify those strengths, assets, and resiliencies that people have, and thinking about recovery not as being linear and having these moments where there's a relapse or someone might go to the hospital or have something happen. We want to reinforce what they've already been through and how resilient they are as a strength of theirs, or talking about the assets that they do have so that they can approach this next chapter in their life in a way with some confidence, something in their back pocket. It's so important to be able to meaningfully share with someone from the outside perspective their strengths and capacities that you've been able to see, because a lot of times when people are seeking support, a lot of times they're not feeling so great about themselves, and that's so important not just to address what it is that's going on or the outward behavior or patterns we're seeing, but to reinforce that each person has their own individual strengths and assets and have made it to the point that they have thus far, and that's they've been able to be resilient in different ways. Last one for this slide is culturally responsive. So aware of recovery language and that beliefs and customs are diverse and can impact the outcomes of recovery efforts. Okay. We also want to be responsive to personal belief systems. So providing linkages to recovery options that are consistent with an individual's beliefs. So one major thing that comes up in my work consistently is use of medications. Sometimes an individual might have a different belief system or have a belief system where they don't see medication as being helpful, or maybe they want to take a more holistic approach. And again, it's really important, whether you're the provider, the support person, a peer, or ally, to really just remain curious and try to better understand a person's own beliefs so that we're not trying to push on something of our own, which then could impact recovery. Commitment to peer recovery support services. So providing opportunities for ongoing peer participation in planning, implementation, and delivery of services throughout the full continuum of care. I saw earlier in the chat we had, I think, at least one person who identified themselves as a peer, and I think that's wonderful. I think we need more peer support and services and funding for that, because it is such important work. Integrated services, so coordinates and or integrates efforts across service systems to respond to an individual's unique strengths, desires, and needs. system-wide education and training. So ensuring that concepts of recovery and wellness are foundational elements. So again, we're taking the approach of strength-based and providing supportive services. We need to make sure everyone who's within that system, whether they're in a role where there's more face-to-face interaction or not, that we all have the same idea of wanting to reinforce recovery is a reality and wellness is important. Ongoing monitoring and outreach in an effort to promote participation, motivation, and re-engagement in order to continually improve the system. Outcomes driven. So outcome measures will reflect the long-term global effects of the recovery process on the individual, family, and community, and including benchmarks of quality of life changes. So quality of life is so important, and this is also in my role, we have a specific measure that as a young person, every 6 months document their quality of life, and it has specific categories socially, academically, or employment wise, where people are able to give their feedback about how they feel the quality of their life is. And I think that that is so important to check in about, and to check in around what it is that each person sees as a quality of life. It can look a lot different for other people, but really that can be a great motivator for someone to engage in services, and for someone to be able to see some changes, even if it's like, let's say none of the things about, like, let's say you have the same job, you live in the same place, but like your quality of life could improve based on how you feel about that job that you do, or how you feel about where your space is, where you're living. Those sorts of things can help be motivating factors that can propel us forward when we're feeling really stuck, or feeling like complacent, like we feel like things haven't moved forward. But then when we're able to dive a little deeper, we're able to see things in a different lens and gauge what it would mean to have a quality of life. All right, so research-based. So we're talking about, we want to be informed by research, and this includes experiences of people in recovery and essential factors such as cultural and spiritual aspects, adequately and flexibly financed. So this means we all know what adequately financed, but in order to permit access to full continuum of services. So this could be ranging from detoxification and treatment to continuing care and recovery support. The service delivery system will be flexible enough to provide the establishment of an array of programming around long-term recovery support to augment those already provided within our behavioral health service system. And then to end stigma and discrimination. So work towards the eradication of stigma and discrimination toward individuals and families seeking treatment and recovery. So we want to promote the highest level of autonomy. So what that means is we're promoting the highest degree of functioning and quality of life for all individuals in our system. The system recognizes that individuals may need to learn new skills to survive in the larger society. Success at an expanding array of life tasks and the assumption of new or enhanced roles in the community as they are defined by the person in recovery over time. Both derive from and contribute to sustained recovery. The system provides emotional and financial resources, social support, and skill building opportunities for individuals to achieve their individual goals. Um, so we're not planning to take the scheduled 5-minute break. I figured we could keep things rolling, but we're gonna segue into a video. So right now, if any of you are sitting at your desk, sitting at home, just kind of take a moment to go ahead and stretch. So stretch your arms up to the sky. Maybe you'll twist back and forth in your seat, just a way to reconnect to this moment so that we can give ourselves a little bit of a mental break or shake up to come back to the training. All right, so once you're settled back down again, or if you need to go grab a glass of water, totally understandable. I'm going to introduce this video that we'll be watching, but I want to give some context first. So I found this is a TED Talk by Sam Fowler, and it's called Wasted: Exposing the Family Effect of Addiction. So it's a longer, it's about I think like a 15-minute video, but I started it later on just to kind of save time, and so that would be a pretty lengthy video, but I want to kind of catch you all up to speed about the first several minutes of it so that we can jump into the part where we're starting at. So in the beginning, this young person, Sam, begins by showing a photo of her family and comments that they, like, just based on that photo, that they appear polished and perfect, but that she knew they were different in some way, but wasn't really sure how to describe it. She then goes to say that later on, she became aware of a disease, meaning addiction, that her oldest brother was diagnosed with 5 years ago. She then describes her life in going to a family weekend at a rehabilitation facility for her brother. And she says that when she was there for the family weekend, that she was told something that has changed her life forever. So she said that this is where, like, the people from the rehabilitation facility told her that addiction is actually more dangerous for the family than for the individual with addictive behaviors. Sam noted that she did not understand how a drug that she wasn't using could be dangerous to her. Then she describes over the years this unfolded, and she understood that in the very worst moments of addiction, including relapses, overdoses, and threats of suicide, the person struggling with the addiction, meaning her brother, was numb, that he was unconscious to who they are and what they're feeling, but the family is sober. And not only do they have to watch someone they love turn into someone they don't know, but they also have to watch them turn into someone that they might fear. She then goes on to explain firsthand experiences with being present with her brother through relapses. Then she begins to talk about the impact on her and her family. And then this is where we'll join the video. So I'm going to go ahead and mute myself so that we can watch this video together, and then we'll reflect on it. Okay. What did people think about that video? Um, as we move forward in the presentation today, we're going to talk about what does it mean to support recovery. And one thing that stands out from what Sam had said was that her brother not only felt that he didn't have a voice, no one was listening, but that no one cared. So I'm curious, for the people who are watching that video, what are some things that stood out to you that Sam was talking about, whether in relation to herself or her family or her brother? Go ahead and throw that in the chat, and I'm going to read the comments as they come up real quickly. And then we can transition to the next part of the training. But I really think she had some really important things to say. And let me see, Dorian is saying that it was so beautiful and poetic, very powerful. She was really brave. Tracy saying real and impactful. Doreen said very heartfelt. Yes, absolutely. Um, Elaine said, I think it was good. Making addiction visible makes it harder to hide and takes away from the person feeling seen and not alone. Absolutely. And Sam did talk about how things tend to amplify with that shame and stigma when it's pushed aside or pushed down, or something that, especially with families, feel like they just have to take on. Um, Um, we also have someone saying heartfelt, I became vulnerable. Kathy said that they will be sharing this video as a family member when others have a sense of what is possible and what families may go through. Absolutely. Hannah said well spoken regarding the effects on the family. Agree about keeping it in darkness. You are only as sick as your secrets. Linda said, I agree. It's important to bring it into the open, but we must look at it like any other illness, and the individual wishes must be respected. Absolutely, even though it is an illness and affects the whole family so deeply and completely. Jessica said, I think the way her brother received messages in their family growing up did influence his addiction. Vulnerability shown by parents and observed by their children is essential in emotional development. Her brother may have learned to use substances to cope with these issues. Definitely. And Gail said, this is very relatable and well done. Awesome feedback. I hope that you all got some part out of that, or if it's something where you take with you or share with someone else, wonderful. That's great as well. So now we're going to dive into what does it mean to actually support recovery. So first off, understanding an underlying condition is influencing your family members' behaviors. So we may find ourselves looking for something to blame. Should we blame our family member or the substance use disorder or mental health condition itself? In general, we should try to give the family the benefit of the doubt. Remember that no one chooses to experience these symptoms. Next is learn as much as possible about mental health and your family member's condition, mental health and behavioral health. So knowledge gives you practical insight and understanding. Learn about available treatments, what therapies and medications can do. Do people with this condition typically spend time in residential treatment? What helps are available for supportive housing or employment? Next is showing interest in your family member's treatment plan. So doctors and other medical providers cannot talk to family members without the patient's permission. So ask your family member to arrange this permission. Talk to the medical team about what to expect from the treatment plan. In particular, ask about possible side effects of medication. Find out how to call the provider if you notice any behavioral emotional changes you're concerned about. Next is encouraging your family member to follow the treatment plan. So this might mean offering transportation to therapy sessions or reminders to take medications as prescribed. Um, because daily prodding about medication can easily insult or anger an adult, handle this carefully. Talk to your family member about their preferences and try to set up a simple system to reassure you that the treatment is continuing as planned. So this is certainly something I've worked through with families before when it comes to medication or therapies, that some at different points in times that a family member, support person can be more invested in certain supportive services more than the individual. And that's something that, again, like you want to toe the line of saying, like being encouraging and encouraging them to participate in these things, but also not at the expense of damaging like your relationship with them, and allowing yourself to also step back so that the person providing the support and services could also kind of explore that further with the person in recovery. So I like to be able to get a conversation with the person if they're dodging phone calls, skipping therapy sessions. And I think that's another thing too that isn't said as frequently, just at like my role as a provider with someone who I'm providing services to, is to identify and address those changes that they come up. And it's not something that I expect a caregiver, family person, especially a parent, to have to manage and navigate on their own. And think about it as taking that off their plate. The last one for this slide is strive for an atmosphere of cooperation within the family. So cooperation means not just offering support, it also means communicating with everyone in the family and distributing responsibility equally. Don't try to, quote, spare family members from stress by leaving the caretaking to one individual. Assign everyone in the household roles to play according to their abilities. Include your family member with the illness as well, making his or her responsibilities to the family clear. Okay, so next is listening carefully. So really just the act of simply listening is one of the best ways to show your support. If your family member says hurtful things, it helps to listen for the emotion behind the words rather than focusing on the words themselves. Try to recognize and acknowledge the pain, anxiety, or confusion rather than getting into unnecessary arguments. That's a really helpful tip. I think just in general, it's great to listen carefully, but also if we hear certain things that are hurtful to us, trying to take that like outsider's approach by trying to connect what is it that like this person's feeling or the meaning behind these words that they're saying. Resume quote unquote normal activities and routines. This means don't let life revolve around your family member's condition. Don't want to scapegoat and especially not overly focus on everything revolving around this. So return to a regular routine within the family. Spend time together on activities unconnected to the illness or disease, such as watching a movie, eating dinner out, or visiting a favorite park. Practice living life with a behavioral health condition rather than struggling against the illness or disease. So again, practice living life, because again, we want to create a life that feels worth living and a high quality of life, not just for someone as an individual, but within their family unit. And we want to do that in our approach of living life with these things going on, not just feeling like we're on an ongoing battle and we're constantly clashing, because that feels very defeating and not like a very enjoyable life to have, where we're constantly in battle against an illness or a disease. Next is don't push too hard. At the same time, remember that it takes time to heal from an acute episode. So allow your family member to rest. Offer them opportunities to ease back into routine activities rather than requiring participation. A gentle approach encourages recuperation. Next is finding support. So outside support and encouragement is critical for everyone in the family, not just the person with the mental health condition or substance use disorder. Whatever your role in the family, stress is easier to handle when you regularly talk to people who understand your experience. Peer-led support groups are available for people living with mental health conditions and substance use disorders, and also for family members. Express your support out loud. So spoken encouragement can reduce stress levels. You don't need to say anything fancy. Practice a few simple, gentle statements like, I'm sorry you feel bad and I want to help. It isn't your fault. It's an illness that can happen to anyone. And then another example is, hang in there because you'll feel better down the road. So again, not just these things that we keep to ourselves and like think about, but but things that we outwardly express. So keep yourself and your family members safe. So if there were a risk of violence, make safety a priority. Regarding physical or verbal abuse, set limits that you can keep. For instance, state that you will leave and call the police if your family member becomes physically violent. Discussing your plans for these situations ahead of time can make them more manageable. Again, this is just like a brief example. There's more to expand on in there, but I want to make sure that we do have enough time to go through the rest of the slides. But one of the things that I think is really important is when we're talking about safety, we don't just mean physical safety, we also mean emotional safety as well. Next is preparing a crisis plan that includes important phone numbers, such as the local crisis intervention team. Include your family member in the planning of this document. Make everyone in the family aware of what they should do in case of emergency. So this would be a great place to have that collaboration where we're talking about each person like has their own role within that situation of if there is a crisis to come up, people already know kind of, okay, my role is to drive this person to maybe, let's say, the living room center, if they need some space to work through what they're going on, but they don't need to go to the hospital. Someone else could call a grandma and then set up childcare. There are different things that like individuals could have in their role. So then if we're planning those things ahead of time in the midst of the actual crisis where things are acute and felt very intensely, we're not trying to problem solve and make decisions. We're just able to go into it and everyone knows what to do. Next is don't give up. So a person with a mental health condition, substance use disorder, benefits enormously from having social support. Remind your family member that you're there to help and you're not giving up. When setbacks occur with one treatment strategy, look for alternative strategies. Try something new and encourage your family member not to give up. Reinforce that a good life is possible. Okay. major point. One of the main things, if you take nothing else from here, is that support is not control. So thinking back about the individual I worked with who had the parents with the mom who really wanted to be a strong advocate for him, this was something that over the course of working with them for a couple years, I had to reinforce that support does not mean trying to control the person. So we can support and encourage family members. We cannot make decisions for them, but we should offer suggestions and input, but be ready to accept and support their decisions. So we don't want to kind of set it up as like, oh, well, you could do this, but I probably wouldn't do that anyway. We want to be able to have it be a collaborative process where we're able to give input, but ultimately know that this person is able to make their own decisions and have that autonomy and not set up more barriers for someone to not want to share what it is that is their preference and opinion. Okay. So they may not choose treatment options that we would prefer, but by acknowledging their right to decide, we create a respectful, healing environment within the family. We improve their immediate quality of life by treating them with dignity. We're also encouraging them to commit to their chosen course of action. So again, this whole process of reinforcing an individual having the right to choose, and by doing that to help with that encouragement piece and further buy-in to engage in the process that it is that they are choosing. The reality is, excuse me, the reality is that we can only control our own actions. We have to learn to give the people around us responsibility for decisions that only they can make. It's ultimately up to them to decide on their goals and strategies. You can encourage your family members, but you must let go of the feeling that you have to solve their problems for them. Again, like letting go of this pressure, and I think especially too in the position of a caregiver or a parent, or an older sibling, of wanting to feel like, okay, I'm in this role to be protective, and I've seen this person at their worst, or I've seen someone I really care about struggling so hard, but by putting on your back this idea of like you need to solve someone else's problems for them, knowing we all have our own stuff that we're always working to kind of evolve from, change from, or just things like we haven't given ourselves the time or energy or focus. Like we don't want to approach it as like, okay, I got to do this thing because if I don't, here's what's going to happen and it's not going to be good. We want to have a more balanced approach. So while it's normal to feel protective of someone we care about, and it makes a lot of sense why we want to help someone not have to struggle and deal with the things that they're going through. We can't just put that overwhelming sense of pressure for us to solve their problems for them, because even if we were to do that, it wouldn't help in the long run if someone's not invested in their own recovery course. So even if it has immediate outcomes that we like and we said, this is great, if that person doesn't have buy-in and isn't invested in their own recovery, then we're going to later get frustrated if or when they choose to take things off course or to switch things up. And that's unfair for us and them to set up that sort of situation. So after this slide, we're going to go ahead and watch a really brief video. It's just like one way SAMHSA is advertising how we can start to talk about what might be going on with a family member if we're concerned that they might be experiencing substance use. So we'll go ahead and watch that and then come back together with a few questions to answer. Okay. Um, Feel free to give your comments on the video, but one of the questions I have for you all in this time that we've spent together so far, maybe in your own personal life, in your work life, why is it that you think that families, again, we're identifying families as natural support people, caregivers, partners, allies, parents, why do you think that they don't engage in treatment services? What are some things that have come up in your own work, or if you're thinking of your own self or within your own family unit, what would be a reason why you might not kind of engage in treatment services? What might feel off-putting by that, or what might be your hesitation? So again, as people respond in the chat, because I'm able to see all the responses, I'll read some of them out loud, but feel free to keep them coming. So Gambling said, absolutely an important conversation to have with your children. Jessica said they don't understand what's going on. Sometimes they don't recognize the symptoms or red flags. Yeah. Or sometimes too, they could think like there might be other reasons for that, like situations specifically. In my work in identifying early risk for psychosis, that's where we are able to give that psychoeducation to families and supports, because a lot of times there's behavior change that tends to come up in someone's socializing or their academic performance dropping. And so sometimes it's providing information about what is contributing to that, though a family might not recognize what it is that's like actually going on. Rose said that members of the family do not want to ask for help. Dorian said fear of breaking up the family and alienating the member that needs service. Yeah, sometimes it's, well, I don't want to interfere. This is for you. I want you to have that support. Carmen said to understand how they can support their family members. Kathy said, as a family member who has been in community with lots of family members, families may not want to engage because they are afraid, don't think they need to, don't understand what they mean. Thank you for that feedback, Kathy. Jerry said fear of the truth. Savannah said they're overwhelmed with siblings, taking care of older parents, working several jobs. Yeah, there's so many demands, and I think too, it can be a lot to balance, and it can feel taxing to take on something else where you would be, it would almost be like I'm being vulnerable is so important, as Sam from the TED Talk video said, but it does take a lot out of you. Andrea said having the correct treatment is a barrier sometimes. Alice said families are leery of letting strangers in, concerned about family secrets getting out. Yes, absolutely. Like this reinforcement of we'll just kind of handle it as a unit, and I don't want other people to judge or make assumptions. Linda said, I think regarding substances, at first it's anger and fear, at first feeling a person who has chosen to participate in the use and develop the problem. Sometimes treatment services are not realistic based on the family schedule. They may close too early or no weekend availability. Absolutely. And again, this is providing services needs to be flexible and accommodating in order to meet the needs of those who are seeking services. Gail said family members feel like it is their, or that others feel it is their fault, not wanting to, or sorry, wanting to keep skeletons hidden. Yeah, again, like no one wants to be blamed or judged, but especially when you're already going through so many emotions, watching someone you care deeply about in recovery. Absolutely. I wouldn't want to be blamed either. We got some people saying denial or fear of facing the issue. They are not aligned with a family member recovery. They might be using themselves. Okay. Stigmas, lack of resources, denial, cultural differences. Yes. Affordability. Absolutely. Definitely like financial barriers. And before telehealth was more accessible and covered by insurances, definitely I think transportation is a major barrier. Okay, so my next question for you all to respond to in the chat box is like, why do you think, what do providers maybe do or maybe they don't do that may reinforce this lack of family engagement? So thinking about all these reasons why families might not engage in services, and I think like a lot of it due to fear and stigma. Like what is it that as a provider yourself, or maybe in your own experience seeing a provider, like what happens where that might reinforce why a family member or support person might not engage in services? So go ahead and respond to that in the chat, just some of your thoughts. I can say from my own observations in working as a supervisor for a team where part of our program is providing that direct support to our, like the family or support people in an individual's lives. I know that some providers might at times like minimize the importance of family. Sometimes if it's someone who's new to the job or new to the field, there may be this fear of, okay, if I start working with a family, that's a big thing to open. And so maybe I just want to focus on the individual and providing them support instead of looking at it from like the larger context of family systems. Sometimes too, maybe it's just that families are left out of the plan. They don't know about services. So like if a young person starts services with us and then we start asking about family, they might say, oh, they're busy or they don't care. But really, sometimes family members and support people have no idea that someone's seeking out services. Another idea is like maybe they're just exhausted. It's a lot, it's too much, and when we ask people to show up, and especially in services that might include therapy or family support and education, it can feel like a huge undertaking. So Atasha said, depending on the situation, it may be too taboo for them to handle. Also, some families are not so willing to have their business out in the open. From my experience, blame is cast upon the person facing the issue without having all of the information. It is mentally draining. Thank you for that comment. We have lack of trust, lack of time. The clinician never asks families to participate. Yes. Maybe family education programs are not available at centers. Fear of alienating adults, experiencing addiction, being judgmental and not addressing their own bias. Absolutely. If we come in with a preconceived notion of what's going on or how the family's contributing to whatever's happening, that can also contribute to like how we approach the services we're providing. All right. So I'm going to keep things moving just so we have enough time here. So recovery support services for families. So just be mindful that some of these services may look different for youth with behavioral health conditions or children of a parent in recovery. But in general, family members often become champions of their loved one's recovery. Resilience in recovery is needed for family members who need access to supports and promote their health and well-being. Families of people in recovery may experience adversities that lead to increased family stress, guilt, shame, anger, fear and anxiety, loss and grief, and isolation. So note that as part of recovery support services, we often refer to assessing, identifying, using, and building recovery capital. So total resources to treat and sustain recovery include tangible and intangible resources and relationships, attitudes and beliefs, mental status, and personal characteristics. This considers multiple ecological levels and life domains. Individuals with some resources are likely to generate more changes over time. For example, human recovery capital includes motivation, spiritual beliefs, cognitive health, physical health. Financial recovery capital includes individual and family income and education, stable living, transportation, and treatment access. And social recovery capital includes supportive family and friends. Community recovery capital includes recovery sponsor, peer groups, peer organization, and mutual aid groups. Right. Examples of some recovery support services. So Smart Recovery is, they have multiple resources, but they have one specifically related for families. So this is if you want some support with someone struggling with addiction, or if someone's addiction is negatively impacting you. So their tagline is, we provide effective and easy to learn tools to help both you and your loved one. Our methods are based on the tools of Smart Recovery and craft therapy, so community reinforcement and family training. Our meetings, available both in person and online, provide concerned significant others the tools they need to effectively support their loved one without supporting the addictive behavior. These tools also help family and friends to better cope with their loved one's situation and regain their peace of mind. All right, and then, we go ahead and go into, okay, I want to talk about these resources first, and then I'll go back to the stress bucket. But these are just some resources that might be useful to look at later. I believe Rebecca is putting in the chat too of the PDFs that have, they were made from SAMHSA, and they're really straightforward handouts that would be nice to hang in the office, or for family members, just a quick way to reinforce how to start the conversation So different things that you can say to start that process. That goes in a line with that 30-second video we watched earlier, and also just like quick images and messages about how we can take care of ourselves, how we can seek support, and be able to start these conversations so that we're actively working to diminish the stigma that comes with seeking support and kind of getting that help that we might need. On here too is NAMI in Florida, the family to family groups I mentioned earlier. Also, Courage to Caregivers is a website with a lot of great resources on it. A booklet that gives information too about substance use treatment. And then the 20-minute guide provides like a practical, compassionate, and effective roadmap for those who are concerned about their loved one's substance use or want to learn ways to prevent it. So there are some prompts, there's 2 prompts of I'm a partner and then I'm a parent. So go ahead and check out the chat box to look at those quickly. Again, those are quick things. If you only have a few minutes to like share with a colleague what it is that you learned today, that would be something that would be a quick reference guide for that. So, all right, last thing before we wrap up today is what is called the stress bucket that speaks to stress vulnerability. So wanting the supports to reduce their own stress vulnerability helps create an environment conducive to recovery. So we all experience stress to some degree. Sometimes stress can be good, can push us to work hard, but too much stress can make us feel overwhelmed, and prolonged stress can eventually lead to problems. The stress bucket is a way to visualize this. Above the buckets are clouds, so the things that cause you stress. So dealing with change, poor diet, job problems, financial issues, lack of sleep, maybe because it's Monday and you missed the opportunity for coffee this morning. All of these can rain into the bucket and gradually fill it up. You release the stress by doing things you enjoy or that help you to stress less. So these things that they show for this example are rest and relaxation, talking to trusted people, good time management. Maybe it's like getting to bed on time and less screen time. So this is a good exercise for you to do maybe as a provider to kind of check in with yourself and see kind of where you're at. It's also something I've used with individuals and then within families and family systems. So individuals each have their own stress bucket, but also as a family unit, you have things that contribute to your stress and then things within the family that help to relieve that stress. So earlier when we were talking about going to a park or going out to eat or watching a movie, those can be things that help reduce stress, but also it can be communicate effectively or check in with each other, those sorts of things that can help make sure that the bucket does not overfill, because then that's when things are in that acute stage. We want to actively bring down these stress vulnerabilities, these things that are going to happen to us, by countering them with these activities and strategies that will help us manage it more effectively. So sometimes when I'm going like more in depth with this exercise too, what I'll do is I'll talk to people about the impacts of trauma and how that would impact the size of your bucket or what your bucket looks like. And also then tap into some strategies that people may use that are unhealthy to release stress and maybe release the stress temporarily, but later on it's not so helpful for them. All right, so as we wrap up for today, I'd like you to think about the following. What's something important that you learned today? or something maybe you plan to implement, and something that you're already doing well. Again, we want to be strength-based and reinforce our own resiliency. And going back to how we started this training initially, like there was some reason, some draw for you to participate in this presentation today. So what is it that you're already doing well that you can couple with the stress vulnerability activity? Or maybe it's, how do I start that conversation of normalizing it's okay to not feel our best within my family? Or the next time I have a conversation with a sibling, I'm going to be more real about how I approach it, knowing that they're going through something difficult right now. So take a few minutes to think about that. And lastly, I just want to thank you all for what you do, even if you're not in the field as a provider. If you're the foster parent earlier who mentioned your role as a foster parent, or if you're someone who's in recovery yourself or supporting someone with recovery, a family member, a friend, a partner, an ally, thank you for what you do. It's meaningful and it's important. And I also want to thank FADAA and the Florida Department of Children and Families for having me today. So I hope that you all found this helpful and that you're able to look at the resources later on as things that might be useful for you. And I hope you all have a great Monday. Go ahead and fill out the evaluation, and I'm going to hand it over to Rebecca for any last minute items.
Thank you, Ashley, and thank you everyone for attending today's webinar. We have included Ashley's contact information so that you may contact her with any further questions. And Ashley, as always, we thank you for your presentation. It was awesome. And everyone, please note a couple of items of business before we conclude. In the chat panel, there's a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to the evaluation. You will need to create a sign-in, or you need to sign in to take the evaluation. That is the way you'll receive CE credits or statements of credit for this event. You will be prompted to register or sign in. For CEs to be reported for CE broker or Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number when you register. After you register or sign in, you will be directed onward to the evaluation. You will need to use the same email address you used when registering for today's webinar through our WebEx link and when you set up your profile in FADAA system. This will connect your attendance and your profile. You will get a second opportunity later today to complete the evaluation through a follow-up email later. The sender will be messenger@webex.com. The evaluation will close Friday, February 4th, 2022. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you again for participating in today's webinar, and we'd also like to thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a wonderful rest of your day. Happy Monday.